The Lifestyle Show, presented by Selina MacKenzie.
Joining me as always is Dr. Ali Nowrouzi. How are you doing?
How are you, Selina? I'm doing good. How about you, Selina? Thank you again for the invitation.
Oh, you're always welcome, and I'm fine, thank you. So I remember cataract surgery 20 or 30 years ago, and it wasn't anywhere near what it is now.
Exactly. It has been changed. It was a kind of revolution in this type of surgery, and it's not just now a normal surgery for the cataract, and we consider it as a kind of a refractive cataract surgery to leave our patient with the best vision for all distances after the surgery.
And what exactly is a cataract?
Actually, the cataract is a terminology of a problem at the level of the crystalline. Crystalline is an anatomical part of the eye behind the iris that it works as a kind of glasses of, for example, in our eye with accommodation, but some changes in the diameter of the crystalline, we can focus for distance, intermediate, near. It's like a kind of a camera inside our eyes. But as it is kind of a special closed area by precipitation of the collagen during the years, and some patients earlier, some patients later. In all of us, we have the cataract or opacity of the crystalline, and then we have to remove it, correct it, and again, have a sharp vision for all distances.
So it's pretty much an age-related thing.
Yes, but there are some factors like, for example, some diseases, some problems like diabetes, hypertension, bad diet, not using sunglasses. These are risk factor in some patients we have earlier. In some cases, genetic is also an important factor that we might have genetic cataract, even in younger generation, around 40 years old. And even younger, we had also cataract in some kids. These we classify it as a genetic problem, and in other patients we usually have something related to the age and the years.
Wow, children! I can't imagine that. So you said it's genetic. It can be genetic.
Yes, in some cases, not all of it. Mainly, it is. Actually age related, but in some cases, around less than 20%, we have also genetic cataracts.
Okay. Well, I was reading about the new type of surgery that you do, and there are three that I was reading about. Femtosecond laser technology, AI-assisted surgical planning, and advanced intraocular lenses. So can you go through each one for us?
Yes, for sure. Actually, this surgery, there are two to three different ways that we usually do. The most advanced surgery is surgery assisted with femtosecond laser, which is a kind of laser that we do all the procedure with a special laser machine. So before the era of laser, we did manually cataract surgery, microincisional with micro blades, and then removing manually the cataract, cutting it and removing it. But the new generation of technology is based on femtosecond lasers, a special fancy laser that it does actually the whole surgery, the incisions, cutting the lens, and we can now adjust all of the parameters, even the size of the incision, controlling the astigmatism, controlling the lens centration by means of this fancy machine, even by micrometers, even less than millimeters. And about the assessments that you mentioned with AI, we have the last generation of technology to study our patients, because we see each patient as a separate patient, and we try to check everything in a customized approach based on his or her life activities. Then these modalities, with these tests that we do preoperatively to study the cornea, the crystalline, the lens, the dry eye aberration, imperfections, and also hearing the patient's demands. We usually put all these data in a special AI-based machine to check everything and even check the lens calculation with AI-based formulae and find out what would be the best option for him. And then after discussing with the patient, then we choose together the best technology for him to see distance, intermediate, near. It's not just a cataract surgery to remove the cataract. It's a kind of a refractive cataract surgery that we correct all these distances. And if the patient has nearsightedness, farsightedness, presbyopia, by the same surgery, even without dense cataract, in even around 50, 55 years old, we do the same procedure to leave our patient without spectacles and glasses. And the new generation of the lenses, the last question to ask me, are full range of vision lenses, AI-based, some of them might multifocal, some of them trifocal. It depends on the case, or some of them extended depth of focus that we choose based on the patient anatomical features, based on the patient demands, and we try to correct the problem for him or her forever.
That was going to be my next question, actually. So this can last forever?
Yes, exactly. It's a kind of a procedure, as I told you, even without the cataract surgery in our patient in the age range of 50, 55 years old, that we cannot offer them presbyopic laser correction. We offer them lens-based surgery. It's like cataract, even without the cataract. And we try to upgrade their crystalline to a multifocal technology or full range of vision technology for them to see distance, intermediate, up close, for all of their activities. And based on each case, we decide in a customized approach what will be the best option for them.
Yeah. And are these procedures quick?
Really quick. As I can tell you that it takes in my hand around 10 minutes.
Oh.
The part of the laser, it's automatic, less than 5 minutes. I think 15, 20 seconds. The laser, just we adjust a special speculum to leave the eyelids open. We center the laser, and in 5 seconds to 10 seconds, the laser opened the incisions, cut the cataract, and then we absorb the cataract with another machine. We call it phacoemulsification, and we implant multifocal lenses. Total procedure, it takes around 10 to 15 minutes.
That's amazing. And is it painless?
Yes, it's painless. Sometimes I explain to my patients with the numbing drop, even they might have a little bit of irritation, numbing, a little bit of sensation of numbness, sensation of sometimes a pressure, but we usually don't have pain. And I explain them each part. They might have a little bit of irritation when we add a little bit anesthetic or numbing agent, and then we explain them some pressure, but usually it's painless.
And do you ever worry, Dr. Ali, that with AI, your role, the surgeon's role, is going to be lost?
No, actually, no. Actually, we use this tool. The AI is not superior than us. We use it to optimize and to make our results better. So actually, finally, we decide about the lens, about the parameters, and we do lots of calculation. And just we use AI for those calculations to be sure about the lens calculation, which is like a black box, that it gives us better calculations, and we check it with other calculation. And when we find some problems and we see that the AI wouldn't be a good option, we try to choose based on other calculation. Just it's a kind of a tool that we use it to make our result better and to optimize our results.
Excellent. We've just had one of our regulars WhatsApp in. It's from Maggie. Lovely to talk to you, Maggie. She says, I'm of an age. Can you ask Dr. Ali, is cataract surgery something you can delay for a couple of years, or does it get worse quickly?
Yes, it depends actually in each patient. Sometimes we have special cataracts that we call it posterior polar or posterior subcapsular cataracts. And when we diagnose them, in few months, the vision it gets deteriorates. So it's better to do it sooner. Usually, when we diagnose cataract, we don't offer our patient to postpone it a lot, because in the previous era we did cataract surgery enough late. For example, 75, 80 years old. But with these new technologies, when we see cataract in a patient with 58, 60, 55 years old, we offer them to do the surgery as soon as possible, because we know it's not just a cataract surgery, and it's a kind of refractive surgery for him or her, and we correct all of other problems, because mainly in these ages we use spectacles for reading. So by the cataract surgery, we deliver good vision for distance, we correct the problem of near, and we leave our patient without glasses.
Okay, Maggie, I hope that helped. We'll give Dr. Ali's details out at the end. Looking ahead, Dr. Ali, where do you think cataract surgery is going to be? I mean, if we've increased so much with AI in the last 20 to 30 years, where do you think we'll be in the next 20 to 30?
It's difficult to answer, but as it goes rapidly, and as I explained to you nowadays we use femtosecond laser, 100% laser assisted cataract surgery. And the next step that we are working with that, because I'm also involved with and the many studies with robotic cataract surgery, for not as a kind of approach for every patient, but it's something for the future for some underserved areas that we cannot send surgeon there, and the robots under supervision of the surgeon again does the cataract surgery.
And do you think we'll ever reach a point where cataracts can be prevented rather than having to have surgery?
Yes, by some, it's unfortunately sometimes it's inevitable. By the way, with good recommendations, with good diets, rich in vitamin D, sun protection, sunglasses, healthy diet, healthy life, we can prevent it and we can postpone it. By the way, in some cases, the genetic is something that we cannot control it. There are some other factors, some other disease like diabetes. I will recommend to our patients to control them very well. And by means of these factors, we try to postpone it and to try to not to have it soon. By the way, as I told you, it's not bad to have it, because sometimes when we have the cataract, we do the surgery and we correct all of the problems for our patients by the same surgery.
Okay, excellent. I just looked to the left in time. We've just had an email in I don't know who it's from. Your last two digits are 62 on your, on your WhatsApp, not email. But this person would like to know what dry eye syndrome is, because he thinks he's got it, he says.
Yeah, mainly the dry eye syndrome. It's a kind of a broad spectrum of disease. For example, we have 2-3 different types of dry eye disease: evaporative. Sometimes we have related to less secretion of the tear film. So they usually have foreign body sensation, sometimes secretion, sometimes red eye, sometimes stinging at the level of the eye. And these are common symptoms of dry eye. We usually check it before any kind of surgery or in a consultation. We diagnose it. We have a new treatment, not just lubrification with the artificial tears. And we try to use a special for example, machines like IPL treatment for dry eye, and also we recommend some wipes, sometimes warm compress, sometimes artificial tears, depending on the dry eye, different types of artificial tear to our patient to correct. And after the surgery, sometimes we have to use more lubrification with artificial tears during a few months. And we have also, as I mentioned, different machines to cure or to control the dry eye in those cases, like IPO, which is the newest generation of treatment for the dry eye as well that we offer to our patients.
Artificial tears. Does that mean if you've got dry eye syndrome, you get no moisture at all? You don't even cry?
Yes.
Wow.
Yeah, exactly. Like any kind of cures that we can use.
Oh, that's not good, is it? Not good at all. So for anyone listening, Dr. Ali knows his stuff. Don't be nervous. I'm guessing people can come and have a chat with you first if they are nervous.
No, usually they come, they ask questions. I try to calm them by explaining about the procedure. As I told you, the new technologies that we offer with femtosecond laser-assisted cataract, everything is now under control better, not just by human factors. So we try to prepare them. And during the surgery, we use some special medication to have a little bit sedation for them to be a little bit more relaxed. We know that touching the eyes sometimes is not as easy for special patients. So we try to prepare them. We try to make the procedure as smooth as possible for our patients.
Yeah, that's what you need. And how can people get in touch with you?
Easily, they can find me if they search my name to our website. They can contact our secretary, and they can write us an email or through the WhatsApp. They can send us a message. There are different centers that I work inside of my private practice in Marbella, in Quiron, Spittan, Premiums Clinic, and also Ochoa. And they can ask an appointment there, or maybe in our private practice. So we see them and we try to inform them about the options and about the solutions to live with clear, sharp vision without spectacles.
Great stuff. And is your website just your name?
Yes, exactly. They can easily search my name, Dr. Nowrouzi, and they can easily find, I think, if they search my name, for both or for bad, I'm among the top surgeons in the area.
Oh, well, there you go. That's what we need. Dr. Ali, it's been a pleasure to chat to you these last few months. Thank you so much for joining us.
Thank you so much. It has been a pleasure for me. Thank you. Have a good day.
You too. Bye-bye.